you all for coming. We love having a full house. This is it's a good turnout. So let me do a little bit of introductions. You know a lot of the people here, but just so that you know all of us, my name is Bruce Jones. Melanie is my wife, and we own Bridge Street Health. I'm going to tell you a little bit about how we met Dr. Hendrickson and Rebecca, because that's a story in and of itself. But you're going to enjoy tonight's presentation. One of the things that's important to us as a medical business is to provide seminars on topics that we think are important. And this one is really near and dear to our collective hearts because of the story that you're going to hear about Rebecca. But we've learned a lot through that about women's heart health, and so we're excited about the opportunity to share what we've learned and how we approach heart health and health in general at our practice. So a little story, a little bit of background, and then I'll officially introduce Mike and Rebecca. About a year ago, we found this cute little house down in a part of Loveland, historic house, and we said that would be a great place to expand a little practice that Melanie has had in functional medicine. So we bought the house. And I don't know, you've probably never done anything where you kind of shoot and then decide you should have aimed in your life. We kind of shot, and then we said, maybe we should have aimed first. So coming out of church, we go here, coming out of church just over there across the way, we said, maybe we should stop and ask for prayer. Maybe God could give us some guidance about, now that we've shot, where are we going? Well, in the little prayer area was this wonderful woman that we had met one time, didn't know her, Rebecca, and we had this amazing conversation with her. She prayed for us about, God, give us direction. What do we do with this old historical house, and how can we put it to use the best way? And when she's done, she said, you have an amazing vision. I have had a yoga practice, and I had a gym, and I love how you look at health. And by the way, I have a husband who's a physician, and he thinks a lot like you do. In fact, he has often thought about starting a practice like that. We said, oh my gosh, is that coincidence? Probably not.
Yeah.
Probably not.
Probably not.
So the next week, Melanie and Rebecca met. We had a number of dinners together where we talked about what could we do. And out of that, we formed this collective, this partnership to build a primary care business. And it's been an amazing journey. That was last October that we started. And it's been an amazing journey in the past 6 months that we've seen an amazing amount of healing and people getting well. We've run a number of programs. So we have had our own journey that we could talk about probably for a half hour, but you didn't come to hear that. You came to hear Rebecca and Dr. Hendrickson talk about women's heart health. And there's some things that we want to share with you tonight that are particularly important. We'd like you to know a little bit about a background on women's heart health and the prevalence of heart attack in women. So for the men that are here, this is for you as much as it is for the women, because you need to know some of the signs and symptoms here because they're different. You're going to find out they're different than what we think about for men. Rebecca's story is just a lovely story, and I'm not gonna even get into it because she tells it so well. We also want to cover some of the signs and symptoms of what a heart attack feels like, looks like. There's some things that are different in women than in men. And we'll talk about some of the risk factors and what you can do to minimize some of the risks that we face just through lifestyle, decisions and choices that we make. And at the end, we'd like to spend time with you and answer any questions that you have. We really want you to understand this topic and go away feeling that you know more about it, and hopefully have some greater insight about things you might do proactively to help develop stronger heart health. Okay? With that, Dr. Hendrickson and Rebecca, I know you know a lot of them, but I think they're going to give a little introduction about themselves as well. And I can tell you, they are the most wonderful partners, business partners, friends, and the acquaintance that we could have to run this kind of a practice with. So I am just so pleased, and we feel so blessed to have them a part of what we're doing.
Thanks, Bruce.
Thank you so much. I'm Rebecca. I am literally wearing my heart on my sleeve tonight. I'm warm, but if it was 95 out, I was going to wear this sweater. So I'm sorry. If I'm up here sweating, I just couldn't part with the hearts. It's part of me. We've attended Crossroads Church for about 15 years. I formerly was Tim Seniff's project manager, the community pastor of this church, and loved that job. Said I would never leave that job unless something really amazing came along. And yeah, what Bruce alluded to, we have been praying for a long time about some opportunity for us. And so when I told them we were going.
So this is one of these quick breaks where we do stand over here so that we're videotaping.
Got it. I could have pulled this over a little bit. I'll hold the waters.
You want to pull it over?
Yeah, let's pull it over a little bit. So thanks,
Pull
Noah.
it over just a little bit.
Noah's our son. He's doing our videography tonight. So anyway, we've been married a long time. Long time. In fact, we just celebrated our 50-year anniversary in June. We live in Mason. We have 3 adult sons, and we have 4 grandchildren under 3.5. So we have a busy life with them. Live in Mason. And then, Mike, go ahead.
You know, this is this whole story, I hope I don't get too emotional.
Tissues.
The older I get, the more emotional I get. But this is very near and dear to me because this is the most important person in my life. So I'll try to keep it together as much as I can. But we've developed an incredible passion for heart health, especially for women.
Yeah.
As you'll hear in this story, there could have been a different outcome here. It's amazing, and to this day, I believe that God orchestrated this in a way that only He could do. And nobody's going to convince me otherwise of that. So, one of the things we want to kind of open with is, you know, after this occurred, we did some research on some things that I've known, but they're very significant. Heart disease is the #1 killer in the world for women. More women die from heart disease than all cancers combined. I've been in practice for 30 years. Most people never come in and ask me, what is my heart health? Most people are worried about, do I have cancer? Could I have cancer? But it's the #1 killer. And more women are likely to die from their first heart attack than men. And often they present with very unusual symptoms that are quite a bit different than women. So that's a little bit of that. Let's get on with this story.
Okay. There are some things, I think we all have a list going in our minds of things that will never happen to us. Like for me, knew I would never become an astronaut, didn't think I would participate in the Olympics, never thought I would have open heart surgery. And now that I know all things are possible, I've actually been practicing my curling. Here's the story. On Saturday, January 17th, I spent the day taking down Christmas. I know, it was January 17th, don't judge me. It's long. We love Christmas in our house, so we leave it up for a long time. We just love the coziness of it. But I thought, today's the day. Plus, we were getting ready to leave on a trip on Tuesday morning, and this was Saturday morning. So I spent the day packing up Christmas and doing all the stuff we do, going up and down the basement steps, carrying bins, and we know how we are women. If you can carry 3, why carry 1? It's like, and that was me. So I was stacking back boxes up and down the steps all day. Finally, by evening, I thought, okay, I've done enough for one day. I'll finish this tomorrow, or finish this Monday or Tuesday, Monday before we leave on Tuesday. So that was it. About 2 a.m. on Sunday, I awakened with a pressure on my chest. You know, people say, like, feels like an elephant sitting on your chest. I felt that pressure, but I also had very severe cramping in my upper back, right across the back of my upper back, my shoulder blades. And I woke from deep sleep, woke my husband, and I said, I'm feeling this thing. And then he said, let's check this out. We probably should get to the hospital. And I said, I think it was something I ate. I said, let me think, did I have salsa? I was sure I was having like esophageal spasms. That's exactly how it felt. So I actually said to him, I'm going to chew 2 Tums and lie back down. So he got up, was fully dressed, and I said, I think I feel better. I did actually feel better. And I went back and laid down in bed. He got back into bed too, lay down in bed, fully dressed, including shoes, and said,
Ready to go.
He was ready to go. He said, if this happens again, we're going. There's no negotiation about that. So that was early Sunday morning. On Sunday, I felt pretty normal. It was a normal day. I got up. I felt a little tired throughout the day, but I just figured it was from the rough night, the being awake like that. So I did some grocery shopping. I did some returns, normal Sunday. On Monday morning, we got up like we always do. I'll tell you about that story. I'm not weird holding a doll baby. There's more to it, actually. I'll tell you about it. On Monday morning, we got up and made our coffee and made our lunches to get ready to head into our practice. As Bruce so beautifully explained, this is a bit of a dream come true for us at this age. I'm going to tell your age, Mike. Okay, there's a big backstory. Mike went to medical school after we were married and had 3 children. So that'll tell you something. He's a little bit of a late starter. So, only in medicine, only becoming a doctor. But we're just talking about the practice and how it was really something we always wanted to do, something like the practice we have now. So we got up that Monday morning, packed our lunches, made our coffee, got in the car, started driving to Bridge Street Health. And on the way, we were just talking about things we'd like to do together now that we had some more autonomy in our work lives. So we got there to the office, and this is me about 9:30 Monday morning. And I'm holding this doll baby because that's my granddaughter's baby doll named Daisy. And my son and daughter-in-law and their 2 baby girls they're staying with us for a period of time. And they left quickly to go to Seattle because her mother is having a health situation. So they left quickly, and Daisy got left behind. So Melanie actually told me this thought that you can do to, if a grandchild or a child or someone in your life leaves a treasured baby doll or stuffed animal behind, you take pictures of yourself with that baby doll or animal and send to the grandchild or whomever and say, look, baby Daisy is going to work with Grammy today. So that's what that picture is about. And I had sent her earlier ones. Baby Daisy was helping me make dinner, and she was on the kitchen counter, and she was in the car in her seatbelt as we were shopping. So I'd sent her several. So this is Monday morning about 9:30. So we got into the office and kind of getting ready for our day. We were seeing a patient at 10 o'clock that morning, and I was actually carrying weights. I was going to train this patient. After she saw my husband as her doctor, she was going to do a little training session with me. So I was carrying weights and stability balls, getting ready to set up for her training.
Up and down steps.
Up and down the steps, carrying weights. I mean, why not? And then she wasn't in for probably another 45 minutes, and Mike said, I'd like to do an EKG on you after this little incident Sunday morning. And I said, oh, I don't have time for that. I said, I'm busy, I'm getting ready for this patient, and I don't want to change clothes. No, we don't need to do that. I felt 100% fine here with Daisy, felt completely normal, felt great. And he kept pressing, and he kept saying, I really think we need to do this. And I said, oh, you're being so annoying. Okay. I relented. I finally relented and said, okay, because we had a few minutes. So I got into the room, and Mike did this EKG, and I thought, okay, let's just get this done, this formality. He finished it, was very silent, and said, go get your coat and go get your purse, and we have to go to the hospital. And I said, why? I feel completely great. He said, you're not great at all. And Mike can share a little bit more about that.
Yeah, so usually, in practice, I've always had other people do EKGs for me. It wasn't until I started the practice that I'm doing my own EKGs. So I had that opportunity to do that. There was nobody in the office yet, and I thought it was a good time to do it. And I was concerned about that episode. I had enough concern, and she really didn't want to do the EKG, but she finally relented. And we had done an EKG 3 or 4 weeks prior, which was completely normal.
And just because, we've been practicing. We've all had EKGs.
We've all had EKGs. Bruce,
Yeah.
we've all had EKGs. We're teaching everybody how to do EKGs. And so I did the EKG, and I looked at it, and I thought, oh my gosh, what am I going to do here now? I have got to get her to the hospital as fast as I can. What was surprising, looking at the EKG, I would have thought she would have had many more symptoms than she was, because the EKG did not look good. I called a cardiologist friend of mine. I said, Brian, I got to take my wife to the hospital. I want to go to Christ Hospital. He said, okay, I'll make a phone call. They were expecting us when we got there. Becky walked in. She was feeling fine. Everything was good. And even when she got there, the whole ER staff was kind of like, she looks good, we'll get some blood, we'll do this and that. I talked with the cardiologist before he came in, because it was a cardiologist I knew, and told him, and he became very aggressive.
Yes, he became very aggressive. He called for someone to bring in an echocardiogram, and someone finally rolled it in, and he kind of grabbed it out of her hand and did the echo himself. And he said, oh, she needs to go to get an angiogram immediately. I remember grabbing his arm, and I said, I don't want to go there. I said, isn't that dangerous? I had heard those places, there's some danger associated with getting an angiogram, and I was actually really trying to convince him that I felt fine, and I did. I kept thinking, what is all the fuss with everybody, because I feel fine, but he said, oh, you have to go. So went in to get the angiogram in the cath lab.
So she went in to get the angiogram, and the cardiologist came out and said she had a 99% blockage of the widowmaker. Now, I can't believe I get so emotional.
It's emotional.
I can't control it anymore. But anyway, 99%. And then just a little bit beyond that, there was an anatomic variant called myocardial bridge. So they couldn't try to do a stent. So she needed open heart surgery.
So then the resident physician came in to talk to us, and it was all so much like a blur. But she came in and she said, we're going to stabilize you a little bit, and then we'll take you to the OR first thing in the morning. Then she looked at her phone and she said, oh, new plan, you're going to the operating room right now. And I was a little bit like, who are you talking to? I was like looking behind me, like, is there someone in back of me that you're talking to? Because I couldn't fathom that it was me. I just couldn't believe I was going to be rolled into surgery. And yeah, to say it was a shock to me and to my family is an understatement. And the surgeon came in to talk to us. A funny story about this surgeon. His name is Dr. Hassan. And when we received in the mail, maybe some of you all got the Cincinnati Magazine recently, Top Docs magazine, his picture was on the front. It came to our house. And it came in the mail, and I remember saying to Mike, who's this guy? And I threw it in the recycling bin. exactly what I said. Who's this guy? Well, that guy was going to saw my chest open a couple of weeks later. So I didn't tell him that story, that I dumped him in the recycling bin. But the surgeon came in to talk to us, and there was a whiteboard, kind of like this, and he had a marker, and he apparently is one of the cardiac surgeons at Christ Hospital who do this surgery robotically. There's some way you can do some cuts on the side rather than cutting through the sternum. He was explaining that to us. He said it's a possibility, but he said sometimes we end up having to do the sternal cut anyway. So he was just kind of giving us options and talking a little bit about that. And then he turned to Mike and he said, "What would you do?" And I said, "Don't ask him." I said, please, you make that decision. He's a fine doctor. He's a great doctor. But I'd rather the cardiac surgeon decide which route we're getting to my heart. So it was decided that we would do the traditional cutting of the sternum. It just felt like a sure thing, and given the emergency situation, it felt like the right thing to do. So that is where we went in. We decided that that was the thing.
And just to add
go ahead.
a little bit with that, I had a personal conversation with him that you probably wasn't aware of outside your room. And she was really too unstable. She was very unstable. You know, when they did that echocardiogram, it showed that her heart function was declining. You know, normal what they call the ejection fraction is typically 55 to 65. Hers was about 40, with wall motion abnormalities that were concerning. And so he really wanted to do this because he was concerned about that.
Yeah, and again, I felt so fine that I still couldn't believe I was being rolled into the operating room. I had no discomfort whatsoever. I felt as normal as I do standing here right now. So I couldn't quite connect the dots that I was being rolled into the operating room when I felt so okay. It was a holiday. It was Martin Luther King Day, and there were no scheduled surgeries in the operating room, nor nothing scheduled in the angiogram in the cath lab, which was beneficial to me because I could get right in. There was no waiting. And again, in the operating room, there was nothing scheduled. So we were getting ready to go into the operating room, and my family who was there, it was also sudden. Some of the family members were there, and friends prayed with me around my bed, and I felt the presence of the Lord. I know Melanie immediately sent out prayer requests to my old staff here at Crossroads and the prayer group that I'm a part of, and I know so many people were praying for me, and I felt it. I knew that. But then it was time to be rolled away into the OR, and I've learned so many lessons through this, but one of the many lessons I've learned is that in the end, you're on your own. You've got all these amazing friends and family, but there are some things, no one could do that for me. I had to do this on my own, away from the family, going into this dark operating room with strangers, basically, and this alleged best doctor in Cincinnati operating on my heart, and he was. But it was a little bit like, turn on the lights, turn on the machines. I could almost hear the machine starting up. It was like, okay, I turned to my nurse and I said, "Is everybody here who's supposed to be here?" And she was so amazing because it was just talking about, it's a tribute to the power of words, because she looked at me and smiled and she said, "You've got the A-team," which was an amazing thing for her to say, because she so could have said, "Yeah, I think so. Hey, did John make it in?" But she said, "You've got the A-team," which was such a reassurance to me. And Melanie reminded me about the power of words. There were two ways she could have said that, and she chose to say, "You're in great hands. You've got us. We're not going to let you go." So, and actually, when I was in there, and right before I drifted off to sleep, and they moved me to this cold metal table, again, flipping on lights. It felt like first day of school or something. It just felt so, like, again, are you ready for me? But I had such a peace. And in true Rebecca form, I would have jumped off that table and said, I'm not doing this. I'm out of here. No, not doing this. I feel fine. I don't want to do this. But I had such a peace, and I had full confidence that I would awaken. I don't remember any moment of thinking that I wouldn't. I assumed I would awaken from this. And at that moment, again, you're on your own. And I was able just to surrender to the situation. By God's providence, I was able to just give myself to it. And that is nothing but kingdom stuff. That is nothing of me or this earth that can provide that. It was completely prayers that were raining down on me at that moment. Oh, we're still on little Daisy up there. Okay. Mike, you want to talk a little bit about the waiting area and the waiting room?
So when she was, I almost felt guilty because I also had that calmness.
Yeah.
I knew she was a good place. I felt like everything was going to be good, and I saw her. She had a calmness that I have never seen.
Oh, great! You've never seen a calmness in me. Nice.
No, at that
moment, yes.
At that moment,
which I could have not been.
When
exactly.
you went, when they wheeled
yes.
you away and
Yeah.
we said goodbye, there was a calmness about that. And
There was.
we had
Out of
family
character.
and friends that came and sat with us. And it was difficult. It was very difficult. All I wanted to do was see her again. A lot of things go through your mind.
Yeah.
Well, anyway, 3 hours later, 3.5 maybe, Dr. Hassan came out and said, oh, everything went great. I was able to do it without putting her on the heart-lung machine. So they did it with a beating heart.
Amazing.
She had no blood products. And he said, everything looks beautiful. And I can almost tell that her heart is functioning better, miraculously. And it was like, it was great, but I did not feel right until I could see her again. And when I got to see her, it was awesome. It was great.
The morning after my late night surgery, I think I got done around 10 or 11. That morning, 2 people from PT, physical therapy, knocked on my door and they said, okay, we're going to get you up and walk. And I said, wait, what? I said, I just had my chest sawed open and you want me to get up and walk? I didn't say that out loud. I said that in my head. Out loud, I said, okay, I'll try. And I did. I got up and with help, walked, moved, and then that just continued for the rest of the time in the hospital. I was amazed at how resilient we really are and the way we can start walking again, the way we can move. This was about 9:30 Monday morning, and this was a little later. How quickly that changes. Actually, that might have been, I don't know if it was that night or the next morning, but again, I was just amazed at my recovery in the hospital and the way that God's presence was with me, and I felt the power and the strength and the confidence to do that when I didn't think I could. And I know you want to talk a little bit about that.
Rebecca, we're all going to have tragedy. Medical issues are going to come to all of us at some point. And Rebecca was prepared. All her exercising and the way she would eat and all the things that she would do helped her get through this in a way that helped her get through it. And she recovered dramatically, very dramatically, and has done extremely, extremely well. And I think it was those decades and decades of all the work she did ahead of time.
Yeah, there were moments, of course. It was all just so much like a dream. I know when I first was able to speak with Mike after recovery, I just looked at him and I just quietly said, is this a dream? I just really, truly wanted someone to pinch me because I thought this surely had to be a dream. It just felt so surreal. But Mike is right. I was talking with one of my nurses one dark night and I was a little bit lamenting, like, I've tried to make healthy choices. I've tried to do things. And she kind of sat me down by saying, I understand what you're feeling, but now you need to stop asking why and now say, what now? So that stuck with me, and it was a little bit, I had a few minutes of a pity party, and she said, no, you don't have time for that. It's not why, it's what are you going to do with it? What now are you doing with your life? But that applies to everything. So many things in our lives, any kind of crisis that comes along, disappointments, things with our kids, things with our parents, losing people we love getting terrible diseases. I mean, so many things. We just want to say, why, God? And we can stay there for a moment. And thankfully, God looks at us as the precious children that we are of His. And He's kind of like patting our heads like, yeah, it's okay. You can ask why. It's fine. But don't stay there. It's okay to ask why. But I couldn't stay there for long. I had to move on and say, what now? So that has kind of become my mantra with a lot of things that happen in my life that I'm still questioning God about things and saying why. But again, it's okay to ask, and it's normal, so we can do that because it's human. But we can't linger there because we will not be effective. And we will lose precious moments of saying why instead of saying what now and using those moments and moving forward. Another moment of a mantra for me as on the morning I was leaving the hospital, the nurse came in and she said, okay, you are in now what we call active recovery. I was like, okay. She said, we fixed you and now it is on you. You have to participate in this. You can't just go home and sit down and expect to heal fine and be fine and sit down for 6 weeks and have your family serve you. Although I was really hoping that is what she would say because I was really looking forward to Mike serving me for 6 weeks. But she said, you're in active recovery. And that really stuck with me too because it's just like everything, whether it's our physical health, our mental health, spiritual health, we have to be in active mode. We have to participate in it. We can't always wait for God to come to us and fix things, which is what we prefer. It's always my preferred route. But God wants us to participate with Him and to step into activity with Him. The onus was on me to do the walking regimen they set up for me, and it was really snowy, and I had to walk through my house like for 15 minutes. It got really boring. I looked at the same old thing. I did a path all through the house, but I did everything they told me to do. I ate protein to rebuild my body. I did the walking. I did the breathing exercises. I did everything because they said, you won't get better unless you actively participate, which again, is such a life lesson for all of us to participate in our healing, whatever healing that is. All right. I think, Mike, you've got some slides now.
Yeah, we're going to just briefly talk about a few things,
I know, get this awful picture off of here.
Yeah.
Oh my gosh. I looked and felt like I had been run over by a bus, actually.
So typically, when you think of heart disease or having a heart attack or angina, there's the obvious symptoms: chest pain, shortness of breath, breaking out in a cold sweat, pain that radiates up into the shoulder and into your arm. But there's also other warning signs. And, one of the things that happened with Rebecca, one of the common things you see sometimes with women, they will have upper back pain associated. If they have chest pain, a lot of times they'll have upper back pain. Or they can have atypical symptoms, neck pain, and all of that. One of the most common things is what she thought, indigestion or nausea, not related to food. It's easy if it's related to food, but if it's not related to food, I talked with somebody just recently, and they were talking about reflux. And I said, well, tell me about that reflux. When do you get it? Well, I only get it when I play softball. And I was like, is that the only time you get it? That's not reflux. That's something more than that. And, You know, things like a new onset anxiety has been reported, this feeling of doom, this feeling that something isn't right. Sleep disturbance. I think one of the things, and Becky can attest to this, I think women hold out because they care about everybody else more than themselves. They care about their children.
Okay, let me insert something since you said that. Okay. The morning I woke up at 2 a.m. with this chest pain and chest pressure. It wasn't pain, it was just pressure. Like someone just was pushing their hand on my chest. And this backache, and Mike said, let's go to the hospital. Honestly, one of the reasons I didn't want to go is because I didn't want to alarm our youngest son who lives at home with us. I just didn't want to upset him, and I knew he would be. So when he came down and we were talking about it, because we were going to the hospital, I was a little bit like, I'm fine, I'm fine. You know, I was trying to convince Noah that I was okay, and that's what we do. As moms, we would rather act like nothing's wrong than to alarm or scare our children, no matter how old they are. Sorry, I just had to throw that in. We talked about children, but that is true.
You articulate it much better than I do.
No, that's, go ahead.
All right. Next slide, if you can get it.
Okay.
So I think the next slide has to do with,
Yeah, I can tell you.
has to do with
Risk factors.
risk factors.
Uh-huh. Yeah.
Oh, there you are. So there's a lot of risk factors, and family history is obviously one.
Which I had none of, but go on.
And she had no family history of any heart disease whatsoever. Obesity, but more importantly, visceral fat. The fat that's around our organs is very, very important. Obviously, the lifestyle factors, high blood pressure, diabetes, and if you have some inflammatory conditions like rheumatoid arthritis and all of that, those are at risk. But there's also other risk. This is mainly in blood tests. You know, what your cholesterol numbers are, your triglycerides, your blood sugar, what your insulin level is. Most people don't check insulin levels. We do. C-reactive protein, HSCRP, is an inflammatory marker. And it's really an inflammatory marker that detects low levels of inflammation that you don't see. Lipoprotein little a, American Heart Association came out with new recommendations last month. And part of that was every person should have a lipoprotein little a done sometime in their life, at least one time. It's about 90% genetic, and that should be done. Next slide. So, you know, we're all different. Every single person in this room there's nobody just like you. Everybody is different. And, you know, so what do you do? What would you do? I think you need to have a regular conversation with your doctor. Not only about cancer and blood pressure, but heart health. It's the #1 killer worldwide. You want to start early. You don't want to wait till the engine light comes on and then do something. So you want to start much earlier. You know, if we would have started 30 years ago, there could have been a different I don't know. Yeah. Maybe, maybe not. Could have been. So you really want to start earlier. Obviously, you want to modify all the risk that you can. And then there's a lot of blood tests and biomarkers and blood markers that can really stratify what your risk is. And, you know, you could have a normal cholesterol, but have really high risk.
No, scary.
So, what do? Well, most of these are really, really obvious. You want to exercise. You want to optimize your diet. You really want to lower sugar. But there's a couple things here. You want to really manage your stress. And Becky will tell you that. You really want to manage stress. And then you want to invest in relationships and do things that you really enjoy. I always tell people, you want to find your sweet spot, whatever that is. You want to do things where the world is right. Everything is right. And, I would encourage that. You want to optimize your sleep. You also want to work towards a healthy weight, but you really want to reduce the visceral fat. Avoid smoking, decrease alcohol intake, all of those things, I think we all understand, but it's never too late to start,
Right.
And you should start as early as you can, and I would start today.
Yeah, and all these things listed up here, and when it comes to food, I was always the one saying, no mayo, no cheese. In fact, hold the bun, put it on a lettuce wrap. I was the one throwing leftover broccoli and asparagus into my scrambled eggs, and next morning I'm like, don't put that green stuff in there. But I'm like, yeah, we're putting this green stuff in here. I was trying to do all the things. I was the one exercising, doing weight training, getting in my 10,000 steps every day, and Mike can attest to this. If I'm at 940, if I'm at 9,400 something, I will walk around my house till I hit 10,000 before I let myself brush my teeth at night. It's like I am that determined. There's just something so satisfying about seeing the 10,000s pop up on your watch. So I thought I was doing all the right things, and I was doing things that, as Mike said, did aid in my recovery. It may have not completely prevented this from me, but again, I was so sure I would never have any kind of heart health, but I was just doing things to just stay overall healthy. But it did end up helping me so much in my recovery. Mm-hmm. But there's more. There's emotional health. That's a big component. I had to really think about that afterward. The stuff we do to our emotional hearts. Heart health is not only about what we eat or exercise. It's also about what we harbor. It's about what we hold. It's about frustrations. It's about quarrels. It's about disappointments. It's about, I'm gonna cry. It's about stuff you hold in your heart that you harbor. Anger, pain, frustrations. It just sits in there and it stews and it brews and it piles up. It's like shoring sandbags. It just kind of piles up. And for me, that was something I thought I was managing. I thought that cannot affect my heart, because for me, it was not something like I could control, like, okay, I won't eat this today. It wasn't something that tangible. It wasn't like doing sit-ups. It wasn't something I could hold or do to help make my heart healthier. It was the invisible stuff, the intangible stuff that I thought was benign. I didn't realize. And I'm not saying that was the cause, but it's in there. It's part of it. It's the way we eat. It's the way we exercise or don't. But it's about what you hold in your heart. And I hate to tell you about that, but there's something, a little stat. One of the things that will pop up if you do a search about causes of heart disease is long periods of unrelieved stress in your life. That will pop up as one of the causes of heart disease. Yeah, you might see cheeseburgers and other things in there too, but I'm telling you, that will pop up when you read that. And according to Circulation magazine, which is a high-impact American Heart Association journal, states this: psychological stress significantly increases cardiovascular risk by 27 to 50%, depending on the type and duration of stress exposure. So, the takeaway from that is heart issues cause heart issues. Heart issues that you're holding on to, and stuff again that feels benign, it feels like something you can't touch, but heart issues can cause heart issues. And that's not just me saying that. That is fact, and that is data backed. So yeah, it's a rule of three. It's everything. If you're thinking about your heart health, you have to see the big picture of everything you're doing every day. I'm in cardiac rehab now, and it's 12 weeks, 3 times a day. I mean, 3 times a week. It feels like 3 times a day, believe me, when I go in there. And they get me in there, and they get me right on the treadmill. The first time I went in there, I was walking like this, like, you know, like I walked right after my PT. People came in and helped me, and they were kind of looking at me, and I said, shh, psst, come over. I said, how's my heart? They're like, well, you're barely moving. Your heart's okay. And because I was so afraid I didn't trust it. I didn't trust my heart. I thought, could it break? Could I do something? What if I go too fast? Well, there was no danger of that at that moment because I was barely moving. But now I have learned to trust my heart. And again, they're telling me, you're in here 3 days a week. The other 2 days a week, we fully expect that you're doing something on your own. I was like, sure. I am, but I did, and I started to, and I am, because they said, this is not enough. You have to be doing 2 other days a week on your own, more than the 3 that you're in here. And they said, and when you get released from this program, we are fully expecting you to be doing something 5 days a week. And I have to, because you know what? I don't want to do this anymore. So I am going to go ahead and follow those rules, but that's how much we need to be paying attention to our heart health. That 5 days a week, which feels like a lot, but I'm going to be doing something to stay on my heart health path. And you know what, we didn't talk about all this tonight to cause fear. I think if I were out there and listening to me talk, I would be calling my doctor's answering service tonight when I get home and ask to see him first thing in the morning, because I would be afraid. But we don't want to cause panic or fear. We just want to help you be informed about your heart health and see what you can do about it. And you know, I'm a zebra. You know the old saying, if you hear hooves pounding, it's not always horses. Once in a while, it's a zebra. And I'm the zebra here. So I'm the odd man out. This is hopefully a rare occasion, a rare happening, but I think after we talked to the cardiologist, we discovered I'm not that much of a zebra. I'm not that rare after all. It happens often to women just like me. And then before we do a little bit of Q&A, I just want to say one more thing to you, and that is this: choose your heart. It's a saying we have around our office. You all probably heard things like, marriage is hard, divorce is hard, this is hard, this is hard. Choosing to eat well is hard. Having open heart surgery is hard. Getting up and saying, I'm moving today. I'm getting up off this couch. I'm walking. Even if it's 5 minutes, I'm moving. That's hard. But the long-term result of not doing those things is really hard. So it's just kind of a thing. And again, that applies to everything. Choosing to have a good attitude is hard. Choosing to not be angry at someone is hard. But also the results of that, those things are also really hard. So it is. We're not getting out of this life with full ease. Nothing's easy. We're only getting through life with hard choices. So that's what I'm leaving this with you tonight. Choose your heart. Choose today what you will decide is the hard part of life.
So we're open for any questions to me or Rebecca. She's the star here, but anything.
I'd rather not have been the star, but yes.
And you can ask us anything.
Yeah.
I have 2 questions, one for each of you.
Sure.
I wanted to know what you saw in her EKG that was so concerning. And for you, I wanted to know, did you have any of those risk factors that were listed up on the thing?
She had high cholesterol.
My cholesterol was climbing. Yes, it was. I mean, it wasn't ridiculous. What was my cholesterol?
Oh, I can't remember right off the top of my head. She improved it at one time, and then it came up.
Yeah.
So if you know what an EKG shows, she had ST elevation, like she was having a heart attack without symptoms. And it was, to be honest with you, when I did the EKG, I thought there'll be some change. Maybe there's some changes and we'll need to address it. But this was significant. And I even questioned, as we got in the car and I was going to Christ Hospital, should I go to Bethesda, which is closer? But I just felt like I needed to go down there. There was a reason, and I just believe that, I believe, you may call me crazy, but I'm not that smart. And I believe...
I'm kidding. He's very smart.
I'm not, but...
Erase that.
I believe that she was protected. I can't explain. There's some things in life you cannot explain. The longer I'm a doctor, I come across things I just can't explain. And I believe she was protected. And I believe the moment, as soon as I did the EKG, I called Melanie. And I know she prayed.
Yes. Yep, she and Bruce, yep.
And I believe that made a difference.
Yes.
And nobody's going to convince me otherwise.
We fully
I
believe
know
that.
how the
Yes.
system works in the hospital. I know how everything works. There was too many coincidences. I'll tell you another brief story. This is crazy, and Noah can tell this a lot better than I do. But we're in the cath lab waiting room on Martin Luther King Day. There is nobody else there. This guy comes in like this with this big long walking stick, and
Like a shepherd's staff, if you can imagine that.
I mean, looked like a homeless guy. So he comes walking in and he sits down across from us and he said, I want to pray for you. Everything is going to be fine. And my son Noah looked at him and said, what can I pray for you about? He said, this is my gift to you. So after a little bit, he gets up and as he walks out, he just says, this is my gift to you. Now, he was either a crazy homeless person or it was...
Or a shepherd. Right.
Or
Right.
an
Or
angel or whatever.
Yes.
It was the craziest thing. And Noah believes more than anything. He said, Dad, that's the Holy Spirit.
Yeah. Yeah.
You can't convince him otherwise of
Yes.
that. And right after that, the cardiologist came in and told us this. And I just believe from the beginning, and I actually believe that maybe going back a year ago, starting this practice, it was all
Yes.
designed for this moment.
Yes. We
I'm
fully
okay with
believe
that.
We
I believe
that.
that.
Yes. If we had not started this practice with Bruce and Melanie, I would have probably still been working here at Crossroads and fallen flat in the atrium and been unrevivable. If this heart attack I would not have survived it where it was and the intensity of the block. So we fully believe it goes back to this time of prayer and God leading us and us joining the practice and Mike learning how to use the EKG machine and insisting he do it that morning. It's just this series of events that point to the faithfulness of God. There's no other answer to that.
And the surgeon was not even the surgeon that was on call. He was in the area, he said.
He was like, I just stopped by. I was like, huh. The top doc just stopped by, yes.
And he was a
Yes.
doc that is very well, he's one of the only docs in this region that does the type of surgery. And it really kind of blew my mind when he said, oh yeah, I did it with a beating heart and everything looked good. And I was like, oh, I didn't know you could do that. So it's been pretty amazing.
So I don't know if that answered your question. So no, I did not have very many symptoms. I mean, I had no symptoms. In
only-
hindsight, maybe, I don't know, maybe I was a little tired. more than usual. I don't know.
Yeah, I think the only other thing looking back is that I noticed your heart rate was a little bit higher than what her baseline had been. And I don't know if that means anything or not. You know, you can go back and look and you can say this and that and whatever. But yeah. And the thing of it is, this was the only blockage she had in her entire coronary artery system. Everything else was clear, which is very unusual.
I know. It's unexplainable, and there are times we just have to say, sometimes the answer is, we don't know.
Anybody else?
My doctor does an EKG every year, and I've always wondered, like, I don't know what you're looking at here. So I don't know how it works, but like, do you think if you did that on her 6 months prior, would you have seen signs already?
No,
No.
because we did one about 3 to 4 weeks, which was normal.
Oh, wow.
And really, an EKG is only going to be helpful if you're having symptoms. And a lot of us, you know, EKGs are like thumbprints. They're all different. Your EKG is different than yours and yours and yours. They're all a little bit different. There's certain things that you look at in that EKG. And this was very shocking. I mean, to be honest with you, this was incredibly a profound change. I mean, it wasn't a little bit of a change. It was profound. But doing an EKG every year, I guess, is helpful. But I would rely on other markers and other things. One of the things that I've learned and that I want to do even more, and I think I've been good at it as a doctor, is listening, but I listen a little bit harder now. I listen harder, I evaluate a little harder, and you know, I think that's the important thing. And you got to look at you differently than you would anybody else in this room. Anything else?
How long ago was this that you had your surgery?
It was January 19th. So I'm 12 weeks post-op. Yeah.
And she's done awesome. And that function of her heart is returned back completely to normal,
Yes.
which was
So grateful.
not completely, you know, there was some question, would it get back completely to normal? But it did.
So thankful. It's, and even in this recovery with all the questions, and it was also shocking and also difficult, but Mike kept reminding me that my heart is better than it has probably been in decades, not just months or years, but my heart is probably healthier than it has been in decades.
I'm very naive to health things, so this question might sound silly, but you spoke of the visceral fat. How do they test for that to know?
The best test to do, well, MRI is the best, but it's very expensive. But there's another test that's very, very good called a total body DEXA scan. So some people do DEXA scans for bones, but there's what they call a total body DEXA, which will give you the amount of visceral fat you have, the amount of muscle, the lean muscle mass, your bone. It kind of gives you all of that. And it can be very important because you could be thin and still have a lot of visceral fat, or be overweight and have minimal visceral fat.
Yep.
Can I just add to that? We can direct you to
Yeah,
a medical practice that
we send
highly know
patients to.
that does these, so if
Yeah.
you want a name,
That's my next question, and
yeah.
I actually know a few people that go to your guys' practice, so I know what your practice is, but the doctors that we're used to by the way, you were my doctor for years, but I'm speaking from the time you retired till now. You can't get any of these tests, because you go in and they just say, not needed, or you can pay out of pocket $7,000 for this test that really should only cost 5 cents, and like, how, is there
Yep.
other, like, any recommendations there?
You know, you can order the test, you just gotta play the game of coding things the right way. And I don't think we've had much of a problem with covering these things, especially now. With the new recommendations from the American Heart Association, there's a lot of things that are recommended now. One of the things is getting a coronary calcium score for men starting at age 40 and women starting at age 45, which is a CAT scan of the heart that looks to see how much plaque you have in the coronary arteries. Coronary calcium score.
And guys, that test is $99. Just so you know, it's
Third bullet point down under assess your risk with blood work and other tests.
Can I just want to echo what you said. I go to a cardiologist. The last time I went, and it will be the last time, I asked him to run some extra tests, and he wouldn't do it. He said, I won't submit them. The insurance company won't pay for them, and they're not needed. And they're on that list, and they're ones that we think give good insight and are much more predictive of the status of your heart. So for me, he helped me make a choice. I'm not going to go back to him because of that, because I want a doctor who is in the game with me to meet my health needs, not to meet his and his company's and the insurance needs. And I think we just have to be, for me, we have to know what we want and stand up for it, because your heart's too valuable.
And I think one of the things I feel like I'm a real doctor now. I feel like I'm a real doctor for the first time.
Isn't that funny? Sorry about those 30 years of patience, but
And I was his first EKG.
yeah, exactly, right.
But it's
Thank
true.
you for letting him practice on
I mean,
you.
I spend
Yes.
an hour with people, and we go through things, and we really evaluate things thoroughly. And, you know, Melanie and I really scrutinize labs like they've never been scrutinized before. I can tell you, we talk about it, and, you know, it's different. And I think sometimes doctors, it's just seeing one patient after another. You don't have time.
Yeah.
This setting, it's in a house, it's comfortable. People kind of come in and they don't want to leave. And, you know, we're able to do things differently in that. So I think part of it's the setting. They're like thinking, oh, I'm an hour behind. I got to do this. I got to do that. So I think part of it's the practice we're able to do. We do all these tests on people. We've even do what they call we did a CAT scan, like an angiogram. You can do what they call CT angiograms, a CAT scan that actually looks at all the vessels and shows you how much blockage and stuff is in each one. It's not as good as an angiogram, but it's pretty good these days. So we send people for the DEXA scans. We look at everything. And what we are trying to do is not look for normal, look for optimal.
Right.
No, who wants to be average? I don't. I want to be above average. We all want to be above average.
Yeah, we don't want to be like on the, you know, when you get your labs done, your doctor says everything's normal, but are you on the really tip top of normal? And we don't want to be there. We don't want to be at the very top of normal. We want to be optimal. And we don't want to, like, we're not satisfied with normal anymore with our health.
Question on the DEXA scan. So how, if you have the DEXA scan and then go on a program and implement change in lifestyle and you feel and see the changes, how far away should you get your next one to like measure the visceral fat and what have you?
It's a good question, and they recommend at least 3 months. So I would say 3 to 6 months. I had one. I had one, and she had one. Mine was not good. I got a C- on mine. She got an A.
And as I said, I got an A. I had it in December. I got an A, but I was on rolling into open heart surgery in January. Yeah.
So the point of this is not, it's not just one thing. If you
Yeah.
have this, doesn't mean,
Yeah.
you got to look at everything and look at people individually, be an advocate for them, see your doctor frequently, talk with them about it
Yeah.
frequently. You go in and get your car checked. People go to the dentist several times a year sometimes, but sometimes people go long periods of time without checking in with their doctor.
Yeah, I think we want to, in our practice, we want to help prevent problems, not fix them. So many times we go to see the doctor to fix a problem, but our mindset is we want to help you prevent problems. And prevention is so much better than fixing. It's so much better.
So Becky, how has your lifestyle changed, one way or the other? Because you were fit before, you ate right, you exercised, you did everything that, as you've indicated, helped you, right?
Yes.
But now, how so? If you do anything differently, what is it? How has it changed? Has it changed
Well,
much?
that's a really good question, and I'm actually still processing. I'm actually kind of still processing everything that happened because it's truly not that long ago. So I'm processing those things. What will I do differently now? I know when I came out of the hospital, I said to Mike, I am never eating a donut the rest of my life, which is not true. I haven't had one yet, but I fully intend to. I'm going to eat a donut. I might drive past the hot sign at Krispy Kreme and just cave in and eat 6 donuts, because I could. But I was determined that I wouldn't, because I was so, again, didn't want to do this anymore. It was fun, but once was enough. And I said, I'm eating perfectly. And actually the first few weeks I was home, and kind of still now, I'm eating like perfectly. I'm textbook perfect at what I'm doing at home.
She's driving me crazy how
I'm like,
perfect she is.
but I will not stay there. I'm still close enough to the situation. I'm going to have treats. I'm going to have birthday cake with my son tomorrow. I'm going to have an ice cream cone this summer at the Twist. I am going to do that. I know I will. But as far as eating, yeah, I kind of ate that way before, not as carefully. I would say I was a great eater, made good choices most of the time, not all the time. I used to eat half a large pizza every Friday night. I'm telling you, for years, I ate half a large pizza. Now I still have pizza. I'm getting cauliflower crust. I'm ditching the pepperoni. I'm doing a veggie on cauliflower crust, and it's delicious, by the way. But yeah, I will continue to up my game a little bit of eating better, working out more. I was doing weight training about once a week. I'm doing it now 2 to 3 times a week. I need to, so I will up my health game a little bit. And I'm also working on my stress level and my things I'm holding. I've had moments of like feeling things, and I've just been kind of like, Lord, help me to let this go. Give me your peace, your presence. I'm not going to let that smolder and sit in my heart any longer. That is one of the big changes I'm making. I'm clearing stuff out of my heart that's not allowed to stay there anymore. I'm doing some things I want to do. I started a children's book about 10 years ago. I finally am taking steps this week to find an editor and get moving on things that would have been sitting on my shelf, and my kids would have found it and been like, this was what Mom did and never finished. So part of the things I'm doing, I want to finish things. I want to do things. I want to keep cultivating meaningful relationships, reach out to people, tell people about their heart health. So as far as lifestyle, simple things along the way I'm changing, but I believe those small things I'm doing will add up. So yeah, not a lot of change, but I'm definitely making change.
But I will add too, she's going to see a cardiologist next Wednesday.
My first visit, yeah.
First visit with
Yeah.
him. He's probably the most well-known cardiologist in this part of the country. And I already had a meeting with him, just him and I. He invited me to his office because he heard about this story and he was so moved by it. And so he's going to aggressively treat you
Yeah.
too.
Yes, whatever he says. I'm not excited about going on meds, but if that's what he says, I'll stand on my head if he tells me to, because I trust him and I know he has the knowledge and the experience to help me do whatever he tells me. Whatever he tells me to do, I will follow that rule to a T.
So that'll be a big change. I know
About
he's
me
gonna
following
aggress-
a rule?
No,
Okay.
about him
Yes,
aggressively.
Yes.
Well, that was gonna be one of my questions, what are you gonna do about the medication, because the cardiologists are gonna want us to go there,
Yes.
right?
Yes.
But another thing, homeopathically, do you know anything about red light therapy along with sauna, and how that can help even stress level and cardiovascular? Do you know anything?
You know, we have kind of,
I do not know know much about. I know of it. Yes.
Melanie and I have had discussions about that.
Yeah.
The data's, if you look at the data in total, it doesn't cure everything, but there is some benefits to that. You know, we're very open to, I mean, if standing on your head 30 seconds a day will improve your health, we're going to probably push that. Yeah, I think alternative, you know, we try to blend, you know, functional medicine and traditional medicine into
Yes.
one.
Yeah. Yeah. Yes.
Yeah.
Yes. Couple questions there.
How would you specifically target the visceral fat if that's your problem?
That's a tough one. Exercise is big. Intermittent fasting can help. The real culprit with visceral fat is what I call three things, three S's. Sugar, sedentary lifestyle, and snacking, because you get insulin surges throughout the day. Visceral fat is more associated with sugar than it is cholesterol. People think it's dietary fats. It's really not. It's sugar. So reducing added sugar.
Not really a question, but just a comment that I'm a new patient with you guys, and I know that you love the setting, but as a patient, I love the mindset, because that's what with the other doctors, like somebody said up there, it's like, they were like, no, you don't need that, you're normal, things are good, like when you know that they aren't. So I really appreciate the mindset that you guys have of. No,
Appreciate that.
Yeah, let's
Yes.
look.
Yeah.
Like if I'm worried, you're gonna listen to it.
Yeah.
I feel like they were just trying to save money, you know, like there were conflicting interests.
Yeah.
I don't feel like that.
Yeah.
Yes. Yeah. Thank you for that.
If there's someone that we feel could benefit from the information that you shared with us tonight, are you gonna have like a recording or something that we could share with people or anything?
Yeah. And we may do more talks.
We are recording.
Okay.
Yes.
We have a website, and if you scan the QR code there, that'll take you to the website. Right on the first page, there is information about tonight's seminar. You can link to another webpage, which is a lot of additional information about heart health. And when the video, when we get a chance to process it, we will load it and it'll be available to you.
Yeah.
So that you can use it or share it with other people.
Yes.
Sure.
Hi, well, first of all, thank you for your testimony. I think it's invaluable, so we appreciate that. Of the tests that you have, like the blood work and the things you kind of build the picture of, is there one that you think you could have did, or maybe you did or didn't do, that maybe would have detected that blockage, like the angiogram, CT?
The CT angiogram would have been something we probably would have done the little a and the apolipoprotein B, because those are the most atherogenic particles of the cholesterol.
Meaning what?
the ones that cause the plaque.
Okay.
And
So you think those would have shown something?
it may or may not. You got to look at, you're just looking at risk. It's kind of like if you smoke, are you going to get cancer? You have increased risk. That doesn't mean you're going to get cancer or heart disease or anything else, but you have risk. There's a lot of people who don't smoke and get lung cancer. Not a lot, but there is people that happens to. So
I actually had that CT calcium score 5 days before my heart incident. And in Mike's defense, he had it a few years ago, 3 or 4 years ago. He kept saying to me, you should go get one of those CT calcium scores. I'm like, I don't need that. I completely blew that off. And then he kept pushing it. And then in our practice, he would tell people about it. And I finally said, I think I'll get one of those. And it was 5 days, and it was an okay score. I was disappointed with it. But even in that, if he had said, you know what, you should probably go get the angiogram CT calcium score to go with that.
We just didn't have enough time.
I would have balked at that too, though.
Yes,
I would have
you
said,
would've.
I don't need that. But I wish I had. But yeah, so
but
there are at least measurements.
at that point, it wouldn't have made any difference.
No, right. It was too late
This,
at that point.
This started
It was too late.
happening decades ago.
Right.
And, the only thing, if you look back, you would say, what would you do different? Even when you went to see your doctor, he said, do you want to go on cholesterol medicines or not? And you would say no. And which I'm not saying cholesterol medicines is the answer, but there's a ceiling to what lifestyle can do.
Yeah.
So you got to look at both. It's not just taking medicines, but it's also the lifestyle.
Yeah.
I was writing down the 3 things you said. The S is to get rid of visceral fat, but I got sugar, sedentary life, and
Snacking.
You forgot that. Right. We all love the snacking. Yeah.
Especially late night snacking.
Uh-oh.
That was the only time you snack.
Right.
It's the worst time
Agree.
to snack.
Agree.
Yeah.
It's, we went a little longer than we had
Yes.
anticipated. And I want to thank all of you for coming. I hope you found it helpful. And if you have a primary care practice you love, great. Go talk to your doctor.
Yep.
Be sure you have this conversation.
Yes.
The one thing that I've learned, personally, as being a part of all this, is and I will speak for myself, I don't do a very good job of managing my health. We manage other things. I probably do a better job of managing car repairs than managing my own health. But we really tell people, you own your health.
Yes.
Manage it and be proactive. And if you don't get from the doctor what you think you need, then maybe you need another doctor. Because it's your health, and you really want, as Dr. Hendrickson and Rebecca said, you really want to make sure that you do things that optimize your health. And I think we take that too. Being normal is good in some things, it's not good for your health.
Yeah.
So we want to be above normal.
Yes.
And so I would say if you have a doctor you love, perfect, that's great. If you have one that, if you don't have your needs met, then I would look to say, where could you get that done?
Yeah.
Because your health is really important, and we don't want anybody to go through what Rebecca went through.
Yeah.
That's not a fun experience. It gives us a great opportunity to have a seminar.
Yes. You're welcome.
And if you'd like to know more about our practice, we'd be happy to talk to you specifically about it. The intent isn't to come here to sell what we do. We think it's important that you understand these topics and that you take them and consider them as you look at your own health and the things that you need to be paying particular attention to. So, so Rebecca and
I
Dr.
think
Hendrickson, thank you.
There was one. Oh, there was one more question here.
If you have any other questions, we'll stay around as long as you want. You can ask them one on one.
This might be a real simple question.
Okay, go ahead.
With the healthcare system, like if my doctor at Christ doesn't want to do these tests, could I have come to your place and have them done? Would you have access to things, tests that I've had at Christ
Christ Hospital? I mean, it would be hard to make a diagnosis or a, you know, because you have, like.
Yeah, we have access to, currently we have access to UC. That's where I came from. UC, Christ, and TriHealth. So we can access all of that.
So they know the systems are getting bigger and
Yeah.
they're taking over and like.
Yeah.
Yes. Yeah.
Yeah.
Yes. Did that answer your question? Okay.
Yeah.
Okay. Okay.